Good morning, everyone. We're just giving a little bit of time to help everyone get their sound adjusted and get connected to the webinar, and then we'll open the connection. Thank you. Hello, everyone. My name is John Skibiak. I'm the director of the Reproductive Health Supplies Coalition, and it's my pleasure and honor to welcome all of you here to this webinar on the newly launched CHI RHSC 2018 Market Report. Last week, as we were preparing for today, Eleni Hahn reminded me that this is in fact the fourth edition of this report. So I'd like to begin my remarks by congratulating all of those who have sustained this endeavor over the years, and also those who've contributed to the publication of this edition, from the growing number of manufacturers who've contributed to it, to the data analysts and reviewers, and to the design and editing team. We have a truly impressive piece of work here that we at the Coalition are proud to co-publish with our colleagues at CHI. The last 10 years, I think, have been a pretty remarkable decade for the family planning community. The prices of contraceptive commodities are lower than they've ever been before. We see more and more generic manufacturers entering the marketplace. We've seen a dramatic increase in the number of manufacturers receiving WHO pre-qualification. And today we see the online soft launch of the global family planning van, a really important step that promises our community greater visibility into global supply chains, greater visibility than ever before. The market report in many ways reflects the many advances of the past decade. They show the impact of a more affordable implant. They show the growing appeal of injectables. And while we have every reason to be optimistic about the decade yet to come, the findings of this report suggest that it will be a different landscape, certainly different from the perspective of reproductive health commodity security. The data we'll hear described today also raises questions. Questions, for example, about the role of the donor community in financing the supply of family planning commodities. They raise questions about who will fill the gap should donor financing decline. Will it be individual users out of pocket, national governments? And the data also raise some pretty fundamental questions about how we as a community preserve one of the basic tenets of family planning service provision, and that is the right to contraceptive choice and the availability of contraceptives and the broad contraceptive mix to make that possible. It's important to note that the donor community remains fully committed to financing commodities in the decade ahead. But how that commitment is operationalized will depend on a clearer understanding of what the next decade is likely to bring, and where we, the reproductive health community, see ourselves 10 years from now. a meaningful approach to reproductive health financing must necessarily respond to the realities of a new decade, and it must reflect a vision of the future in line with the values and priorities of the reproductive health community as a whole. So to that end, we in the Supplies Coalition have been asked to lead a community-wide process of visualizing an effective and sustainable ecosystem for RH supplies by 2030. That effort will present a 10-year vision of commodity security, describe the realities and challenges likely to prevail in the coming decade. It'll assess the relative effectiveness and efforts currently underway to address those challenges, and provide a set of recommendations for achieving RH commodity security, with special attention to the contribution of the donor community. This market survey really represents a key building block in that visualization effort. It, along with other supply-related analyses, the commodity gap analysis and other analysis currently being undertaken, and the input of individuals such as those on this call, will help frame that discussion moving forward. What I'd like to do before I end my remarks is just give a few points before I turn the floor over to my colleague Alan Staple. There is a limit to the number of people who are able to join the GoToMeeting platform. I think it's something like 100 people. So what we've done is we've opened a YouTube connection. I'm not sure right now whether people have already started spilling over to that, but once we reach that 100 mark, automatically people, I think, will go over to that. Throughout the course of the presentation, all participants will be muted, and then after the presentation is over, participants will have a chance to ask questions, submit questions on the YouTube chat box, and through the webinar platform question box. If there are any questions that we're not able to address during the course of this webinar, we will get back to people with responses to them. Again, it really depends on how much time we have to address those. So again, let me thank all of you for joining the call this morning, and it's my pleasure now to turn the floor over to my colleague Alan Staple.
Thanks, John, and good morning and afternoon to everyone. My name is Alan Staple. I'm a vice president at the Clinton Health Access Initiative and head of our global markets team. I want to thank also some of the donors that have made this work possible, the Gates Foundation and the British government's Department for Foreign and International Investment. They have stuck with this over a number of years, and I think we all have seen that with data, you know, we can plan better on the business side and on the service delivery side, and that's really what the start of this project was about. None of this would be possible without the continued participation of the suppliers. We know it takes work to supply the data that is requested, and we hope that you're continuing to get value out of the reports and the conversations that result from this. Overall, as the suppliers know, we are trying to expand the market for family planning products by 30 to 50%, and the data drives policy discussions and drives decision-making about funding both at the country and at the multilateral level. So your continued participation and support on the supplier side is very, very much appreciated, and we understand the work that's involved and would like to thank you. You know, from my perspective, I think what's been incredibly worthwhile out of the project has been the resources that come from these reports that help companies think about new markets that they could enter, where there are gaps in the market for certain types of products, what the opportunity might be for improved products, and just a better, you know, a better visibility of what is a very complex, multifaceted, not just one market, but hundreds of different country markets that they need to address. So the feedback I've had from folks in industry is that this report is really one of the only, this is one of the only resources that is available free of charge to the community, so that people have common access to planning data for both the business and service delivery perspective. So again, thank you to all that have cooperated and made this possible over the last 4 or 5 years. We expect to continue with a similar format in the years to come. And I would now like to turn the podium over to Martin Smith, the Managing Director of the FP 2020 Secretariat at the UN Fund. Martin.
Thanks very much indeed, Alan, and good morning, good afternoon, good evening to all of you. Thank you so much for the opportunity to contribute to this very important webinar. Great thanks to RHSC and to Chai, to John and Alan and their teams, and particularly to Ryan and Eleni and Vanessa for their collaboration with FP 2020 on this market report. Just a couple of quick comments from me as we get started. Firstly, as many of you will have seen in the FP 2020 annual progress report catalyzing collaboration that was launched at the International Conference on Family Planning in Kigali in November of 2018, more women and adolescent girls than ever before are using family planning in the 69 lowest income countries in the world, in the 69 FP 2020 countries. And that number is now over 317 million in those 69 countries, which is 46 million additional users more than existed in 2012 at the launch of the FP 2020 movement. And that is an increase of 30% on top of the historic trend. As much as we've accomplished, of course, as a group of commitment makers, as a partnership, as a movement, and sincere thanks to all of you on this call, particularly all of those commitment makers to the FP 2020 movement, as much as we've achieved collectively, we recognize that the original and very ambitious 120 million additional users goal will not be met by 2020. It'll take a few years longer, perhaps 2024 or 2025, but the commitment is as strong as ever to reaching that goal. But as we look at our initial finish line, if you like, or our initial tape that we need to break in 2020, our eyes already turn to the 2030 agenda, as John set out. Our North Star is, of course, universal access to family planning. The Sustainable Development Agenda calls for achieving universal access by 2030. And I do hope when we get into our Q&A section, we might be able to have a brief exchange on some of the movement's thinking on what may come after FP 2020 and the absolutely critical consultation with you all, with the family planning community, on what shape that might best take. Just a couple of other contextual points before I move us along. Firstly, of course, we're going to hear a little bit about donor funding. John mentioned this earlier on, and just to give some broader context, the Kaiser Family Foundation trends of donor financing for family planning that were published in the latest FP 2020 progress report show $1.27 billion in bilateral donor financing for family planning. That's a 6% increase from 2016, but still we are below the peak that we saw in 2014 of $1.43 billion. We're essentially flat to all intents and purposes at the moment as far as family planning bilateral donor financing is concerned. And we should also view this, of course, in a broader ODA context. ODA hasn't grown that much over the last decade since some very significant infusions that we saw in the early 2000s, and the latest OECD report published last year had a very small decrease from 2017 of 0.6% related to 2016. So our relatively flat donor financing in family planning should be seen in a broader context, of course. Two other very quick points, one of which is we published for the first time domestic expenditures on family planning in our latest progress report, 31 countries here. And you will see, I hope, a great effort that is being made by everyone involved to increase our visibility on donor financing, on domestic financing for family planning, ranging from $200 million spent in countries like Indonesia, India, and Bangladesh, through to much smaller amounts in a range of other sub-Saharan African countries. You'll see that in our latest progress report. The greater visibility that we strive for is a collaborative effort that we continue on. And just to reference that half of FP 2020 countries expressed their financial commitment in terms of the domestic resources to be spent on family planning commodities. So we have a job in front of us in terms of tracking those critical domestic financing commitments, which make up a very, very important part, an increasingly important part of the picture here. And overall, we have about $3.37 billion spent across the 69 FP 2020 countries, and we're increasing our visibility on the donor piece, as I said, the domestic piece, but also getting better estimates of the out-of-pocket spending and the accuracy of our estimates around out-of-pocket spending, and thanks to colleagues including RHSC and Track 20 in the partnership there as well. I hope to be able to speak a little bit more about the future of our global movement in our Q&A section, but for now, sincere thanks to our colleagues at RHSC and CHI for this very important market report, a powerful tool with extremely powerful messages. And with that, I'd like to hand over to Vanessa, Associate of Global Markets at Clinton Health Access Initiative, to give us the main presentation this morning. Thank you so much.
Thank you, Martin, Alan, and John. I want to start off by giving an overview of the Global Markets Report Visibility Project. So the report uses shipment data from suppliers to provide a comprehensive look into the FP 2020 public and social sector family planning procurement market. Each year, our suppliers provide confidential shipment data to CHI, which is amalgamated in a secure database and used to produce the outputs and analyses seen in the annual report. So this slide lists the 14 suppliers that have participated in the project. One thing to note is that this supplier base represents the majority of suppliers supported by donors. The market report has been published annually since 2015, and since then it has been used as a decision-making tool for the family planning community. It served as an important resource for donors, suppliers, countries, and implementing partners to make procurement decisions and strategic investments to better serve contraceptive users. Here, I'll give an overview of the report sections, as well as what's new and noteworthy for the year. So in terms of what's new, we have incorporated 2017 data and new sources for the donor spend analysis. We previously used RHI data for our donor spend analysis, but found while we were updating our analysis that there were data concerns with the USAID PSM feed. So we worked with USAID and UNFPA, the two major institutional procurers of FP commodities for FP 2020 countries, to come up with new data sources, which I will mention later. This year's report is composed of 3 sections, each with its own data sources. The first and main body of analysis is a supplier shipment analysis, which uses confidential shipment data we received from suppliers. The second part looks at donor spend analysis. For USAID, we use their contraceptives and condoms shipments reports, a publicly available data source. For UNFPA, we receive data directly from its procurement branch. And finally, the last section of the report includes a discussion of key trends and themes from CHI's discussions with a number of suppliers, donors, and partners. Now I will go into the public sector contraceptive market trends. The market report is focused on the 69 FP 2020 countries in the public sector only, which is defined as Ministry of Health and government-affiliated procurers, as well as institutional buyers, which include UNFPA, USAID, and SMOs. The market report does not include the commercial sector. So a distinction I want to make here is that sometimes the social sector is counted as private because out-of-pocket fees are charged. However, in our market report, we have counted the social sector as institutional procurement that is part of the public sector. In terms of methods, we are focused on product-based modern methods only. So the table in this slide shows the aggregated volume from supplier shipment data from 2011 to 2017 to the 69 FP 2020 countries. One exception is the male condoms category, in which volumes are taken from RHI due to a higher fragmentation of the market for male condoms. Now, it's important to note that in almost every year, volumes from our suppliers in the market report exceed the volumes seen in RHI in each of these methods for the 69 FP 2020 countries. So now I will go into the key trends from the 2017 supplier shipment data. This graph shows the market value or market size of contraceptives. We calculate market value by taking shipment volumes from suppliers multiplied by prices from USAID and UNFPA. The total value of the public sector market in 2017 was 186 million. The decrease in market value from 2016 to 2017 of about 3% is less pronounced than the drop in market value we saw from 2015 to 2016. We also see that from 2011 to 2017, the overall market value declines by a compounded annual growth rate, or CAGR, of 6%. When we look at which methods drove this decline, we see that from 2011 to 2017, the decline in market value was largely driven by a decrease in orals combined in progestin only, which on this graph is the gray bar, and injectables, which in this graph is represented by the dark blue bar. From 2011 to 2017, orals, shown in the gray bar, declined by a CAGR of about 16%, and injectables, shown in the dark blue bar, declined by a CAGR of about 4%. The next graph looks at the market from a couple years of protection, or CYPs shift lens, which is calculated by dividing shipments by their corresponding CYP factor. 2017 represented the largest decline in total CYPs shipped in a single year since 2011, declining by 25% from 2016 to 2017 and 5% annually since 2011. The longer-term decline from 2011 to 2016 was primarily driven by a decline in shipments of orals, combined and progestin only, which we see in the dark gray bar, by 4% annually from 2011 to 2016. The large decline in CYPs we see from 2016 to 2017 is driven by a 55% decline in CYPs shipped of IUDs, which here is represented by the orange bar from 2016 to 2017. Now, when we take a look at CYP mix, we see that long-acting methods, which include the IUDs, shown here in the orange bar, and implants, shown in the yellow bars, still dominate the CYP mix at about 60% of the total mix. This is because short-acting methods have decreased at a higher rate overall compared to long-acting methods. For long-acting methods, an increase in implants from 2011 to 2017 partially offset the decrease in CYPs in IUDs. Now, this graph illustrates how, from 2016 to 2017, the market value remains relatively unchanged compared to the large decline in CYPs shipped. In earlier slides, we saw that the most pronounced trend in CYPs shipped in 2017 was a significant decrease in CYPs shipped from IUDs. Now, IUDs are by far the most cost-effective method at a cost per CYP of about 10 cents. Thus, even though CYPs shipped for the IUDs method dropped significantly, the market value for IUDs dropped by a relatively much lower amount. The next two slides look at the donor spending analysis portion of the report, specifically trends from USAID and UNFPA, the two major institutional procurers of FP commodities for FP 2020 countries. While we have data from 2011, we focus on trends from 2012 onwards, as this was the year donors made their commitments at the 2012 London Summit on Family Planning. The graph on the slide looks at USAID contraceptive shipment values to FP 2020 countries, with data from USAID's Overview of Contraceptives and Condom Shipments report. So as we can see, spending from USAID remains relatively flat from 2011 to 2015, and then declined from 2015 to 2016 by 37%, and again from 2016 to 2017 by 25%. The USAID report we used as a source for this data attributes the decline from 2015 to 2017 to USAID's transition from the Deliver project to PSM. Now this slide looks at UNFPA procurement values. From 2012 to 2017, UNFPA's procurement value decreased by about 2% annually. From 2012 to 2015, procurement values remained relatively flat between 108 million and 120 million. While a substantial 27% decrease was observed in 2016, the value of UNFPA's procurement increased by 25% in 2017, although not reaching pre-2016 levels. This slide looks at discussion points and themes raised from TRI's consultations with suppliers, donors, and partners. So stakeholders were concerned with seeing that the market value of the 69 FP 2020 public sector had not rebounded to pre-2016 levels. For context, the 2011 to 2015 market value range was about 273 million to 362 million. In 2017, the market value was 186 million. Stakeholders were also concerned with a decrease in donor spend in recent years and growing commodity funding gaps to meet unmet FP need. More generally, stakeholders commented on the nature of supplier shipment data impacting year-to-year trends. So it's important to note here that trends in procurement are impacted by a number of factors other than consumption. These include operational factors such as manufacturing lead times and the timing of shipped orders versus procured orders. Trends in procurement may also be affected by supply chain considerations, such as current stock levels or stock necessary to fill pipelines. These factors impact year-to-year trends, but do not reflect consumption patterns. And finally, stakeholders provided suggested explanations for observed trends in certain method categories, such as IUDs and implants. For IUDs, Egypt was a top country driving the IUD shipment volume decline in 2017. Stakeholders suggested that the devaluation of the Egyptian pound against the US dollar could have contributed to Egypt's decrease in volume for this year. Pakistan was the next country after Egypt driving IUD shipment volume decline in 2017. Here, discontinuation of USAID's commodity funding support to Pakistan likely played a role in lower volumes in 2017. For the remaining top markets for IUDs, stakeholders cited cyclical procurement patterns as a possible reason for the IUD decline. For the 2016 to 2017 decline in implant shipments, supplier production constraints were cited as contributing reasons by a PSM report. So that brings us to the end of the presentation part of the webinar. The report is available online at the link posted here. And we also encourage any suppliers interested in joining us to contact myself and my colleague Eleni using the contact info listed here. So thank you, and now my colleague Eleni will be opening up our Q&A period.
Thanks very much, Vanessa. Just a reminder to folks on the line that you can submit your questions through the webinar platform. There should be a box, and we'll just give a minute for questions to come in. So here's a question here. Can you explain how this report findings reconciles with the other data sources, such as the commodity gap analysis and the FP 2020 progress report? I think this is a really great question, and it brings up a really important point that this market report should be taken into consideration with other data points and reports, such as the ones that this question points to. I think what's really important to recognize is that when we do compare these different data sources, the messages that arise from all of these different data sources, despite the differences in the starting points, are that the trends are very similar, or they are the same. And maybe just to comment on the differences between these data sources, there's often a lot of differences between the data coverage, such as the different sectors. So this report, as Vanessa mentioned, covers the public sector only, whereas some of the others, the commodity gap analysis, as well as the FP 2020, covers both public and private. The scope is quite different often as well, depending on the number of countries of the various different data sources. And also the comment that Vanessa made on procurement trends being different than demographic data versus consumption data. So procurement data taking into the account of quantities of products that are already procured. Sometimes it is also constrained by funding, and also reflects supply chain considerations, such as the inventory that already exists. Demographic data being that data that is often a point-in-time estimate, and consumption data, which is quantities of product that is consumed by women, which doesn't often account for supply chain considerations. But again, just reiterating that it is, in this particular report, is definitely important to be taken into consideration with all of these data sources to paint the overall picture. And when we look at it, the trends are very, very similar. Do either John or Martin want to jump in to comment on that question?
I think you answered it perfectly, Melanie.
Thanks, Eleni. Yep, absolutely.
Great. So we have another question here. Given 2020 is just around the corner and the trends that we are seeing here, what should we expect as a community? So I think this question, maybe Martin, it would make the most sense for you to comment on.
Sure, thanks very much. And as John obviously spoke in his introduction about consultation on the sustainable ecosystem for supplies through to 2030, of course, all of our collective minds turn to, as I say, accelerating through to 2020 and getting as close as we possibly can to the ambitious goals across the FP 2020 that we've set. But also our minds turn to what comes after, and that process is starting right now. Many of you who were at ICFP will have heard the announcement made by the core conveners of FP 2020, UNFPA, USAID, the Gates Foundation, the British Department for International Development, and the United Nations Foundation, on a consultation which is being launched, and it is underway as we speak this morning. A consultant has been engaged by the core conveners with terms of reference to run an open global consultation process, which will include an open call for feedback and requires really everyone on the line this morning to give their views on what has really been beneficial about the FP 2020 movement, the huge amount that we've learned as a community together, but also what should be changed, what could be improved, what should the movement that takes us through the SDG era to 2030 really focus on. There's, of course, been huge benefit, huge strength in our movement, in our partnership, but we're all highly committed to hearing your feedback. And it will be a very intense process over the next few months, and the core conveners of FP 2020 would like to make some initial comments on the shape of the post-2020 movement at the Women Deliver conference in Vancouver in early June. So you can expect to be contacted, expect to hear more about the consultation, but please, if you would like to give your specific views, then do let me know, msmith at familyplanning2020.org, and I will make sure you are connected to the consultation process so that you have an opportunity to give your very clear views on what's been great, what needs to improve, and how the family planning movement should move from 2021 to 2030. So thanks very much for that great question, and back to you, Eleni.
Thanks, Martin. I'm just seeing through some of the questions that there were some difficulties looking at the slides, and also some folks also asked for links to the report. Just a reminder, this webinar is being recorded, and so after following the conclusion of this webinar, Alex will be following up with a link to the recording of today's presentation, which will include the slides and the voiceovers as well as the report. We have a question here. Considering the procurement systems now used, we should be able to talk about 2018 data in January 2019. What can we do to speed up the turnaround of this analysis so that we can have current data? Thank you very much for this question. I think this is a very important question that alludes to the speed of getting data so that we can make better decisions. I think that maybe just to comment on sort of how we get this data, first off, this data comes to us from suppliers, and we get this data on an annual basis. So it requires us to collect this data from suppliers and them to aggregate their annual data so that we can then vet it and input it for analysis. I think that we will definitely use this opportunity to see how we can improve this process so that we can achieve better timelines, and use this opportunity to rely on our partners and our suppliers to figure out how we can get data in a timely manner. There's another question here. Has there been any analysis regarding the public sector spending on contraceptives to fill the gap, i.e. for IUDs and for implants? John, I'm wondering if you wanted to comment on this in the context of the commodity gap analysis.
The commodity gap analysis looks at both public and private sector consumption of contraceptive commodities and the relative size of each. The gap there within the context of the gap analysis, there is a gap projection which compares the amount of funding that's made available in the latest year for which funding information is available, and what the cost of commodities will be in years ahead based on a trajectory of growth in consumption. So so there is for each year an estimate of what the gap will be, and for each contraceptive method, it's broken down by method. So I think if someone is interested in looking at that, you can certainly see the gap analysis to find that data. I don't have the numbers in front of me right now, but certainly the figures are available.
Thanks, John.
And it's can I just jump in, and it's Martin here. So, of course, we're, as I said earlier on, we've got much greater visibility now on domestic expenditures for family planning. 31 countries have published data in our latest progress report. We are highly confident that we will have more than that in our next report and increase our visibility on the critical commodity component. Great report published by our colleagues in the PSM project late last year on the 8th of November, which gives us some very good information for a range of countries on domestic commodity expenditures. And as I say, with half of the FP 2020 countries expressing their domestic financing commitments in terms of commodities that the government will be purchasing, I think we're going to have a much greater ability to really see how domestic financing is progressing. We'll have 2017 numbers, and I realize that the lead times are longer than those which one of the previous questions pointed to. We're normally seeing around the middle point of 2019 domestic expenditure data for 2017, and that will include then seeing the effects of the increased finance commitments that many of the FP 2020 countries made at the London summit in July of 2017, and therefore understanding how countries are progressing in financing increasing proportions, we hope, of their own commodity needs.
Thank you, Martin, for that. So we have a question here that I think I've commented on briefly before, but I can reiterate. So it's in terms of interpreting the overall downward trend we saw in procurement in 2017, what I'm hearing is that it doesn't necessarily mean that there is a decline in women's access to family planning. Is that right? So I think, again, this question should be answered with focusing on what this report and what this data is. And again, this is looking at supplier shipment data, procurement data. And so it needs to be taken into context with all these other data sources related to demographic data as well as consumption data. I think that, given the differences, it could be that procurement data is an indication of what is to come based off of all these different supply chain factors. And yet at the same time, there is definitely, this definitely is one data point that needs to be taken into consideration into others ones as well. I think one of the main conclusions of this report that can be drawn is that the market for these 14 suppliers, which represent the majority of donor-supported suppliers, what we've seen here is that it has shrunk and declined over the past 7 years.
Eleni, if I can come in again, Martin here at FP 2020. So the question, is hinting at, in relation to overall FP 2020 progress. As I say, we saw continued increases in usage of modern methods of family planning as at July 2018 across the 69 countries, an increase up to 317 million current users of a modern method of family planning. And we see in many of the coverage indicators that we're considering for MCPR, for example, we are seeing increases in many of the FP 2020 countries. So we're not seeing a link between this shipment data, if you like, and decreasing coverage or reducing MCPR at this stage. What's also worth pointing out is that we do have indicators on stockouts, core indicator 10 and 11 of FP 2020's monitoring of progress across the 69 countries. And we're not, we don't have, I would say, conclusive evidence of improving stockout indicators overall. There's quite a lot of noise in the data, so I would say sort of trend data on stockouts across the 69 countries is a bit elusive for us to be able to talk about whether there's been significant progress on reducing stockouts. We are hoping to augment what we have in our stockout indicators with increasing use of LMIS and other data to be able to see less based on facility surveys and more based on what's happening in countries in real time to understand if stockouts really are moving in a positive direction or not. Thanks.
Thank you, Martin. There's a related question here.
Eleni,
if there was did you want to comment, John?
Yeah, no, I also wanted to add to that and just sort of make reference. Last week here at the RHSC, we had a meeting where a number of people who've been involved in the production of the market report, the costed gap analysis, the Kaiser Foundation report, and other work, John Stover, we kind of looked at this question, and in fact, the question is a complicated question, in part because many of the increases that we've been seeing taking place in countries in terms of contraceptive users are located in countries that are not really very dependent on donor-funded commodities themselves. So it's I don't think one can necessarily say that because numbers are growing and yet donor funding is decreasing, that means that it doesn't really make any difference in terms of access. There are countries that are highly donor dependent, and I think it really requires a careful analysis as to what the significance of the gap is. We know from the research that's carried out under the gap analysis that the private sector, plays a huge role in many countries, and that may very well be a large part of what's filling the gap. But again, I think it's difficult to say, and I think knowing what we know about the role of the private sector, we could really easily see out-of-pocket expenditures, reaching a threshold in terms of what women are able to pay. So I just wanted to add that remark.
Thanks, John, for that clarification. And I think it's important to make the distinction, once again, between what we're talking about when we're talking about the private sector. So very often a lot of analyses that start from the consumer or the user perspective will look at out-of-pocket expenditures, which could include services that are obtained or products that are obtained from the social marketing sector. And again, that's included already in this report as part of the public sector. So that's just an important thing to keep in mind. That being said, the true commercial sector that is being asked about whether or not that's playing a larger role, it is possible. But given again that this report focuses on just the public sector supplied by these 14 donors supported suppliers, that conclusion would have to be drawn from more data and better data visibility. That is, however, an overall question that we've posed to these suppliers is whether or not their commercial sector has increased what they've seen. And that's not something that they've discussed, that they've seen. And these hypotheses, in terms of the explanations for the trends, we delve into a little bit deeper in last year's report. And another hypothesis that I can potentially just provide is that the market potentially has shifted to other suppliers that are not participating in this particular report. And so when we took a look at this analysis, we looked into larger markets such as Bangladesh, India, and Indonesia, which have large presences of local suppliers that they procure from. So we looked at the Ministry of Health, Family Welfare reports and procurement tenders that confirm that the existence and the procurement of from these suppliers, from local suppliers that are not participating yet in this report, does exist. But in terms of whether or not that portion has increased is something that is difficult to discern because, again, of the limited nature of the data that we have. We only have in Bangladesh and Indonesia data for 2015, 2016, and in Bangladesh 2017. And so it's difficult to determine whether or not prior to 2015 what that trend looked like. For India, when we look at the public sector MOHFW reports, we haven't seen, so we have data there from about 2011 to 2017, and we haven't seen an increase in procurement from those other suppliers. So that would point to the fact that that isn't necessarily being taken on by that sector. And all of this detail of this market visibility analysis for these large markets can be found in the appendix of the report. And so that's included in this year's report as well as last year's report. I know there were some French listeners on the webinar today, and I know it was difficult just given the language barrier to really get into some of these trends and understanding. If you have specific questions or perhaps, you can reach out to Vanessa and I afterwards, and we can set up a call. We'd be happy to walk you through it with some of our French-speaking colleagues. There's a question here. What are the main lessons for donors? Should they rebalance their programming towards a greater weight for commodities? I think this is a really interesting question. And while it's difficult to draw definitive conclusions from this data alone, I think this question is a really important one for the overall community to be looking at as we plan for 2030. To ensure that there is the appropriate allocation of resources between SP commodities and other areas. And I think it's also perhaps important to look at the significant commodity gaps that we continue to see year after year, and that will need to be addressed somehow within the context of planning for 2030. John, I'm not sure if you wanted to comment on that, or Martin.
Yeah, I think one of the interesting things about this analysis and also the gap analysis as well is that I think it's prompted all of us to rethink the way we look at many of the categories we've sort of taken for granted. Donor funding and recipient countries. I think what we've seen is that although the donor role may be less significant in many countries relative to the private sector, and here when I talk about private sector, I'm talking both commercial in social marketing that is not receiving commodities through donations. There are nonetheless countries that are very dependent on donors, even if they, do not make up the majority of countries. And so I think it's not a simple question about donor support versus declining donor support or no donor support. There are certain countries where donors make up 80% or more of contraceptive commodities available in those countries. And I think any recommendations that are made as to the role of donor support looking forward need to take that into account. So I think it's as I said, I think this analysis really has prompted many of us to question some of the assumptions and the categories that we've used in the past to look at commodity financing.
And if I can just echo that, as John has said, there are many countries that are still highly dependent on donor commodities and that simply lack the fiscal space, if you like, to increase that in the short term. So many of those countries are making small and important increases in their domestic financing for commodities, but the lion's share, if you like, of those commodities will need to continue to be donor financed, certainly in the short to medium term. And we do see that where countries are able to grow their economies, that growth in the economy is a significant driver to increasing domestic expenditure. And there are a range of FP 2020 countries where economic growth is healthy and where there is scope for this fiscal space. And in many countries that is manifesting itself, of course, in terms of universal health coverage related efforts, either through public sector or through private health insurance. And there are an encouraging number of FP 2020 countries that are gearing their efforts around family planning through UHC orientated mechanisms, from countries that are more at you might say at the top of the S-curve, the mature countries like Indonesia, through those accelerating somewhere in the middle, like the Philippines and Nigeria, with its recent basic healthcare provision fund launched in 6 states, encouraging efforts being made there to integrate family planning in UHC schemes. Thanks.
Melanie, this is John. I just wanted to also comment on an earlier remark that was made on the listeners calling in from Francophone Africa. That's something that we and the coalition can certainly help support in making this available to Francophone speakers.
That would be wonderful, John. Thank you very much. Okay, I think that's all in terms of what we can cover today. If there's any detailed questions, please feel free to follow up with myself, Vanessa, RHSC directly. Thank you all so much for joining, and thanks to John, thanks to Martin, thanks to Alan for providing, and Vanessa for providing a great presentation today. And we will look forward to continuing this work. Thanks very much.
Thanks very much.
Thank you.
Thank you, everyone.